I'm going to talk about lipedema. Who know here about lipedema, right? Okay, good, perfect, better than I thought. That's nice. Well, first of all, we need to know the distribution of adipose tissue, because premenopause, usually the women people, fat accumulation is basically on hips, thighs, in lower body part, and men, we have more belly fat or inside fat, or visceral fat. So this is the main difference between men and women. But what's the difference between lymphedema and lipedema? It's totally different disease. Lymphedema refers to tissue swelling caused by an accumulation of protein-rich fluid that's usually drained through the body lymphatic system. Usually affects an arm or one leg, is unilateral. And the main cause of lymphedema here in Europe, for example, is after cancer surgery, when the glands are removed. And lipedema is a disease, a long-term condition where there is an abnormal buildup of fat cells in the legs, thighs, and buttocks, and sometimes in the arms. It's bilateral. 60% of women worldwide and 1% of men could have lipedema. 20% is hereditary, not linked to mitochondrial DNA. So we can see here the difference between lymphedema and lipedema. And remember that cellulitis can exist alone, or cellulitis sometimes could be a consequence of lipedema. The problem of lipedema is that physical exercise and sometimes we follow a good nutrition is difficult to remove, and can increase the incidence of depression and anxiety or eating disorders, like this picture with anorexia nervosa, a woman with lipedema. So the main difference between lymphedema and lipedema, it's practically the same physiopathology, but in the different way. In lymphedema physiopathology, first increase interstitial fluid stasis, and then finally subcutaneous adipose tissue deposition. And lipedema increase subcutaneous adipose tissue deposition, and in the end, finally, interstitial fluid stasis. So here you can see that lipedema is inside of ICD-11. Lipedema is a disease recognized by World Health Organization in 2018, but currently there is still no consensus on its diagnosis, so clinical examination remains one of the best presumptive tools. In Spain, the prevalence of lipedema is around 11% to 16%, probably more. Lipedema is like aging process, because lipedema increases chronic inflammation, fibrosis, endothelial barrier dysfunction, vascularization impairment, mitochondrial dysfunction, and free stress, oxidative stress, and free radicals. And also we can see alterations of female hormones. Well, as you know, more amount of fat tissue, the tissue increase the pro-inflammatory adipokines like TNF-alpha or interleukin-6, for example. And in this picture, you can see with infrared thermography the cold areas of subcutaneous fat, because the subcutaneous fat have low blood flow. If the oxygen doesn't arrive at subcutaneous fat, it's so difficult to this fat to be oxidated and removed. Yeah. Here you can see normal fat and lipedema fat with this type of nodes and fibrosis. You can take pictures if you want, don't worry. Here you can see an examples of lipedema. And the proposed criteria for diagnosis of lipedema include the following: bilateral and symmetrical character with minimal involvement of the feet, or edema with small dimples, nose and possible pitting, pain, tenderness and ease breathing, persistent swelling of the lower extremities despite elevation or weight loss, sensation of heaviness or discomfort in the legs, ligamentous hyperlaxity, polycystic ovarian syndrome, endometriosis, hyperosmia, difficult to lose weight with nutrition and physical exercise, sometimes family history, mother with lipedema or paternal grandmother with lipedema, hypothyroidism, leaky gut syndrome, trochanteric bursitis, and negative stemmer sign. Stemmer sign basically is when somebody have lymphedema, not lipedema. Here you can see an example of another sign. It's a cough sign. This line here in the ankle, or we can find cough sign on the elbows in advanced stages of lipedema. We have at least 4 stages of lipedema and 5 types of lipedema depending on the distribution of fat accumulation. When does lipedema manifest? Mainly when hormones are changed, in puberty, stress, pregnancy, post-surgery, menopause, of course, and sometimes in depression and some medications. We need a holistic approach to treat lipedema. There's no cure, but we can treat it with nutrition, physiotherapy, medical treatment like mesotherapy, psychotherapy, surgery, and physical exercise. So you can see here a patient from Brazil, a friend of mine. You can see the right thigh, the right leg. The volume is lower if we compare with the left leg because the patient has been done lymphatic manual drainage. This is a Godoy method, a Brazilian method to treat lymphedema and lipedema with compressive bandage. And with this machine can help to pump the fluid of lymphatic fluids passively. Obviously, nutrition is the basis of treatment for lipedema disease. We can use keto diet, or sometimes low carbohydrates diet, or sometimes food maps, depending on if the patient have bowel problems or food allergies. Physical exercise is so important for lipedema. We need to improve strength exercise to prevent joint injuries. The swimming is very good choice to treat lipedema with physical exercise because it's without impact, joint impact, and without gravity. Aerobic exercise, of course, yoga and Pilates. Rebounding is very good and funny exercise. And vibration platform, for example. So here you can see a sample of physical exercise with own body weight. And we can use the same treatments of preventive and anti-aging treatments or preventive aging treatments as to treat lipedema. Because as you can see here, exercise increase AMPK, decrease mTOR, caloric restriction, or intermittent fasting is sometimes good for lipedema. Remember that lipedema tissue doesn't not reduce significantly after diet, exercise, or even bariatric surgery. Use surgical treatments to reduce lipedema tissue like liposuction, a different type of liposuction is another option. Supplements for lipedema should focus on reducing tissue inflammation, like omega-3 fatty acids, like curcumin, fisetin, antioxidants, and so on. Remember to check vitamin D levels and thyroid function, another type of hormones, of course. And early treatment of pain, edema, and mobility provides better results, and use compression and manual lymphatic drainage. So as you can see in this slide of episode of Game of Thrones, here somebody forgot coffee from Starbucks coffee. I mean, think about lipedema in your medical consultation, not only cellulitis, overweight, and obesity. Nothing else. Okay, thank you very much.